I'm Joshua Goldman, board-certified plastic and reconstructive microsurgeon focused on breast reconstruction. If you're watching this video, you may be curious about breast reconstructive options, or you or a loved one may have been referred to our clinic to discuss those. Whether you are a genetic predisposition patient who's recently been diagnosed with a breast cancer gene, or a recent diagnosis of breast cancer, or you have a previous reconstruction that you're wishing to enhance or improve on, we have options for you. Our goal during this consultation will be to deliver a plan to you working together that suits your specific breast cancer journey and meets your desired outcome aesthetically and functionally. You may have already spoken with your medical oncologist or your breast cancer surgeon about things like whether you're going to go with a lumpectomy and radiation or a mastectomy where the breast is removed. You may have also discussed whether you're going to do one side or both sides. During your consultation, we'll go over what the aesthetic and risk factors are associated with each of those types of surgery and the ensuing reconstructive options. When I break breast reconstruction down, I break it down into two parts. The first part is timing, and the second part is type. With regard to timing, that's am I doing something at the time of the mastectomy or not? Sometimes we do a delayed reconstruction, meaning you finish all of your cancer treatments and we start the reconstructive process down the road. If I am doing something at the time of mastectomy, I'm typically placing a tissue expander or a placeholder that will maintain the breast skin and the shape of the breast and allows us to decide on the size of the breast prior to doing any definitive reconstruction. Occasionally, I'm also assisting the breast cancer surgeon on improving the contour of the chest for those who decide to go flat and not place any expander, implant, or any other types of reconstruction. That will still allow the patient to have a soft, flat chest and allow for the use of a breast prosthesis if desired down the road. That brings us to our definitive reconstruction. The simplest and most common reconstruction type is to utilize silicone implants. Those maintain the shape of the breast and are a powerful tool within reconstructive and aesthetic surgery. They do, however, come with specific complication risks that we will discuss during our consultation. The other common option would be to do an autologous tissue reconstruction, utilizing your own tissue to remake the breast. This has the highest aesthetic and general satisfaction amongst patients, but it is a bigger surgery, and we'll discuss the balance between those two things. The most common version of that is taking the lower abdomen, which most people are happy to donate, up to the chest and recreating the breasts out of that. Another option would be a hybrid where we do both options together, utilizing both your body's tissue and an implant to provide you the best aesthetic outcome. During your consultation, we'll go over all of the risks and benefits of each of these options and discuss how they impact your particular journey. If you have questions, I do recommend writing them down in a notebook, and we'll go over them during your consultation. I look forward to meeting you and discussing together.